The prostate gland is a small organ located between the bladder and the penis. The primary function of the prostate is to secrete the fluid that nourishes and protects sperm. Enlarged prostate is a health issue that becomes more common with age. In this video, we are going to discover 10 signs and symptoms of an enlarged prostate. Benign prostatic hyperplasia, also known as enlarged prostate, is a common condition wherein the prostate gland is bigger in size but not cancerous. It is one of the most prevalent diseases in aging men, and it is also the primary cause of lower urinary tract symptoms. Number 1 on our list is frequent urination, especially during the night. If you find yourself getting up multiple times to use the bathroom, it could be a sign of an enlarged prostate. This is called nocturia, and is when you have to urinate 8 or more times per day. At times, this urge to urinate may be urgent as the enlarged prostate gland puts increased pressure on the urethra and bladder, making it increasingly difficult to hold in urine. A second common sign to look out for is difficulty urinating and urinary hesitancy. As your prostate presses on the urethra, it can block urine from the bladder going out through the penis. This makes it hard to start a urine stream, and you may find yourself with the inability to urinate. The pressure on your reproductive organs and urinary tract can be painful. Some men feel the need to push urine out, which makes it even more painful. In more severe cases, pain may also be due to infection, resulting from an untreated enlarged prostate. One of the issues with an enlarged prostate is that it can block the flow of urine from the bladder, which prevents it from emptying completely. This increases the chance of bacteria growing, increasing your risk of developing an infection. Urinary retention is when you are unable to empty the bladder completely. It is both a symptom and complication of an enlarged prostate. There are 2 forms of urinary retention. Acute urinary retention will last a short period, while chronic urinary retention remains persistent. The doctor will have to insert a tube, known as a catheter, into the bladder to drain the urine. If you are finding blood in your urine, this could be a possible sign that you have an enlarged prostate, and there are 2 forms. Microscopic hematuria is when blood is detectable only under a microscope. Gross hematuria is when the presence of blood in the urine is obvious, and the urine looks red, pink, or brownish. Urinary incontinence is the involuntary leakage of urine. This usually occurs when control over the urinary sphincter is either lost or weakened. An enlarged prostate may impact sexual function, and it can cause erectile dysfunction. Painful ejaculation is also a sign of prostate enlargement. If you have any of these symptoms, don't ignore to seek medical advice. If you learn anything helpful, give it a thumbs up and share it with anyone who might benefit. Subscribe for more health-related content, and as we always, take care of yourselves. Thanks for watching.